With healthcare costs skyrocketing in the U.S., millions of uninsured Americans cannot afford to undergo procedures critical to their health and survival.
With no insurance, I have a lot of medical problems, and it has put us in extensive debt.
According to Families USA, a nonpartisan research group focused on health issues in the U.S., 89 million, or 1 in 3 Americans, went without health insurance between 2006 and 2007.
I had a hip problem. The premiums would have been exorbitant, and the deductibles would have been outrageous. And insurance companies rejected me.
For many uninsured Americans, the lack of health insurance can also pose dire consequences. Today, 7 Texans dying each day due to a lack of health insurance. For older Americans between the ages of 55 and 64, the lack of health insurance is the 3rd leading cause of death after cancer and heart disease.
I broke my leg in 3 places, and the doctor told me that I was going to have a total knee replacement and had to be rescued and all these expenses and everything. And after we found out what the cost was going to be to remove my knee, since I have no medical insurance, we just didn't know how we were going to possibly pay for this, other than sell our house.
It's not just the uninsured who are affected. Even some insured individuals chose to do without medical procedures because they simply could not afford to pay the high out-of-pocket expenses, premiums, and copays expected. Well, now there is an alternative. A new trend is emerging as companies and individuals are discovering healthcare without borders. Nearly 500,000 Americans traveled abroad for medical care in 2006. And according to recent reports, the number is estimated to have doubled in 2007. Patients who have traveled overseas for medical treatment are happy to get the treatment they need at a price they can afford, and at facilities they say are equal to or sometimes superior to those that exist in the States. Poonam Dhawan, founder of one of the leading U.S.-based medical tourism companies, the MedTrava Group, learned firsthand just how expensive healthcare in the U.S. can be.
My mother was diagnosed with cancer about 3 years ago, and that was the first time we actually dealt with the healthcare system as closely as we did here, and she was uninsured. Taking her through the system, we also met several people who had been diagnosed with serious illnesses but were unable to take the care that they needed. They would have to either take second mortgages on their homes or even take money out of their retirement.
Her personal experience led her to leave a successful career in IT behind to establish a medical tourism company, the MedTrava Group.
So when we were doing our research to look at different options available around the globe, we found that India had emerged as a global healthcare destination. It had not only great facilities, but also the infrastructure required to make it a sustainable destination. It has one of the largest pharmaceutical industries in the world. India graduates about 30,000 doctors and nurses every year. The facilities were absolutely world class. The doctors and surgeons were very highly qualified, many of them qualified and trained in the US and the UK. Now, cost, of course, is a very important factor, and the prices for all this, including the cost of travel to that destination, is 60 to 80% less than what you would spend here.
A coronary bypass can cost upward of $80,000 in the U.S., compared to $8,500 in India. Hip surgery can be performed in under $8,500 as opposed to $70,000 in the U.S. Cosmetic procedures like gastric lap banding and facelifts are also popular among medical tourists.
I decided to look up this information on this medical tourism that they were talking about and looked on the internet and found MedTrava, and I went to India for my surgery. I can't believe that I paid so little for all that I had and the care that I had was given to me while I was there in India.
When we are doing our research and we want to find a destination, quality was absolutely most important, and we looked at the facilities that did actually have the right level of quality, at least as comparable to what we would find here, and in cases even better than what we would find here.
MedTrava has assembled a network of impressive hospitals in India, affiliated with the world's leading medical institutions like Johns Hopkins, Harvard Medical, Mayo Clinic. These hospitals have also earned accreditation by Joint Commission International, a global leader in hospital accreditation standards by which healthcare quality is measured in America and around the world. As part of the accreditation process, the hospitals practice strict blood safety and infection control processes, along with 1,300 other measurable standards that ensure quality, patient safety, and high standards of clinical care. The MedTrava Group offers fixed-price medical packages and door-to-door services to facilitate the entire process, provide access to doctors, scheduling procedures, even arranging visas and discounted air tickets for the patient's travel. As the sun sets on another happy customer, the economics of medical tourism also brings new hope for U.S. employers and employees who are increasingly weighed down by out-of-control healthcare costs.
Businesses are facing a tremendous issue with the rising cost of healthcare. We have at MedTrava created a benefit program, MedTrava Health Benefit Plan, which actually attaches to an existing benefits plan or an insurance product to be able to offer the full services to offshore this healthcare and to send their patients overseas for treatment is a great viable option.
My airfare, my companion's airfare, the hotels we'll stay in afterwards, and even some of my costs in the United States to see doctors there before I came here. So instead of $70,000, it's $15,000, and I'm good to go. I'm a new bionic woman. I would do this again because the overall experience has been truly excellent.
They gave me a birthday party in my room. My doctor came to my birthday party. He sang to me. Amazing. And all of my whole trip, everything involved was less than $10,000.